are you? My name is Ladonna Patterson. I am faculty over at the School of Nursing. I am starting, believe it or not, my 10th year as faculty here. Yesterday started my 10th year as a faculty person here, and I've been a nurse since about 2003. Laura invited me over to come talk to this group about what nursing is, and then if you guys have any questions for me, you can certainly take those questions. So here is the definition of nursing. As a teacher, I tend not to read slides, but this is what the American Nurses Association has defined nursing as being, which is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human responses and advocacy in the care of individuals and families, communities, and populations. That's a lot, so I always interpret what that means, right? So for me, that means that as nurses, we don't just take care of one person, right? If you are my patient, your children are my patients, and your brothers and sisters, like your whole family is my patient. And sometimes nurses, we work in the community, which means the community is our focus of care, right? And our main goal, how I like to describe it to people, is that where we have, like, for example, medicine that takes care of a medical diagnosis like high blood pressure or diabetes, the nurse heals the patient, if that kind of makes sense. So we have to take into consideration not just that this is a patient who happens to be diabetic, but that this is a mother who works and has a grandchild at home and maybe a husband who's also sick, if that kind of makes sense. So my kind of catchphrase is that nursing heals the whole, meaning nursing heals the whole person. And so these are a lot of words to say that we promote health to heal the whole person. That makes sense to you. So when we think about nurses and where they work, the most common setting for nurses to work in after they graduate from school, and when I'm saying nurses, I'm talking about the nurse who graduates from like our BSN program, which is what we would call a new grad, basic entry nurse. Most likely they're going to work in the hospital. We are seeing some shifts in healthcare where nurses are moving more towards working in community-based settings, so going actually out into patients' homes to take care of them. But there's urgent care, primary care, public community health type settings, so clinics, free clinics in the community, going actually to somebody's home, like I mentioned, in home health, working in a nursing home or an extended care facilities. And then you see the bottom options there. These are all the other opportunities that nurses have. Like once they finish their basic education and they're working as a registered nurse, they can then move on, elevate their career by earning a master's degree, earning some certifications, becoming a legal nurse consultant, travel nursing. A lot of students are interested in traveling around the country or even around the world with their nursing degrees. So there's so many options for individuals who have earned a nursing degree or who are interested in nursing because you need nurses everywhere. Any questions so far? I feel like I'm talking quite a bit. I'm looking at people's faces. I'm super informal, so if you have questions, just ask at any point in time, or if there's something on the slide that you're curious about, just let me know. So we have different levels of nursing practice, and some of the most basic levels of nursing practice start with people earning what we call a CNA, Certified Nursing Assistant certification. There's also some nurses who we call licensed practical nurses, and so these nurses have gone to school to earn a degree in about 18 months, and so they're LPNs. The level up from that would be the RN, which would be the person who graduates from our program. They would become registered nurses. And people who are registered nurses, they can become so by earning an associate's degree from like a technical college or earning a bachelor's degree, which is what we offer here at the university. And then they pass what we call a licensure exam. So this is important to know, and I'm not sure if you guys knew this, but most students are interested in becoming nurses, but they don't realize that just graduating with a nursing degree doesn't qualify you to be a nurse. You have to graduate with the degree and then also pass what we call NCLEX, which is a licensure examination. So school is what prepares them to pass the licensure examination, and once they pass that, then they can use the title RN or registered nurse. So after that basic level, becoming an RN with a bachelor's degree, then we moved on to more advanced practice in nursing. So there's a nurse practitioner. CRNA stands for Certified Registered Nurse Anesthetist, and so these are the nurses who basically provide anesthesia during surgery. Lots of people want to become CRNAs because they make a great deal of money. But it's a competitive field. field to go into, especially now because more and more people are going into it. There's a certified nurse midwife, clinical nurse leader, which is a degree, a master's degree program that we offer here at our university, and many of our bachelor degree students come back to our master's program to get their CNL, but they're clinical nurse leader. And then there's also nurse educator, which is what I do to become a faculty member to teach in a nursing program, and our master's program also offers that degree as well. So nursing at UWG, I kind of started to touch on it just a little bit, but we have what we call our BSN degree, which is our Bachelor's of Science in Nursing degree, which, that's kind of what we call our basic entry program or our more traditional program. We have an RN to BSN degree, which means that these are nurses who have earned an associate's degree, but they want to come back and earn a bachelor's degree. So they're already registered nurses, but they want to earn the credentials as a BSN prepared nurse. And so sometimes, especially in our healthcare climate, the facilities are telling their nurses who have earned an associate degree, they're actually requiring them to go back to school and get a bachelor's degree. So oftentimes when I talk to people who are interested in the nursing field, I say just go for the bachelor's. If you got the time and you got the money, just go ahead and get it, because you might get into work and before you know it, you're working a year or two and they're gonna tell you you have to go back to school anyway, and then if you don't complete it, then you lose your job. So I'm telling people just go on ahead and go for the BSN. But we do offer that RN and BSN for those nurses who have an associate's degree and they're wanting to earn the credential or the degree of a BSN. We have our MSN programs, which you have to have earned a bachelor's degree in order to go into our master's program. And these are all of our programs are nationally accredited by CCNE and approved by the Georgia Board of Nursing. And just kind of some stats. U.S. News and World Report ranked the UWG School of Nursing 31st in the nation in online graduate nursing education. So we have a really great online nursing program. I'm also in our online nursing program because I'm working on my doctoral degree right now, which is an online program through the School of Nursing, so I can say for myself. I'm a student here and I teach here, so it's a great program. Either way. And I talked to you guys a little bit about the NCLEX exam, which is our national licensure exam to become a nurse. And most schools of nursing are rated based on their NCLEX pass rate, and ours is 91%. Usually 80% is good, ours is 91. Typically schools who fall below 80% are kind of, it's true. They get a visit from the Board of Nursing. We haven't had any of those. Oh, that's it. So I went to those faster than I thought.
Good job.
What questions do y'all have for me, or do you have any questions at all?
You mentioned something about a licensing. How long is that licensing process after you get the degree?
That's a great question. So most of our students are actually licensed within 2 months of graduating. It depends on when they take the NCLEX exam. So during their senior or very last semester with us, we start to get them ready, like the application process. They have to wait for the state boards to send them what we call an authorization to test. So sometimes that can take some time. It just depends on what's going on. But many of our students have taken that test and get licensed within, 60 to 90 days of graduating. It just depends. Some students want to take a break after they graduate. Like I took a month off. So it's like, I'm gonna have fun, I'm gonna party, I graduated, and then I tested. So I didn't get licensed until about maybe 3 months out. But typically, it varies. So a little bit on the student, a little bit on the process, but between 60 to 90 days after they graduate.
And one more question. You were mentioning the various levels of nursing. Which one was it that made me mention, I'm not sure, there is one where you go an additional, you get your license and you're functioning sort of like a PA.
Mm-hmm.
Is that something that you offer here too?
We don't. I think what you're talking about is a nurse practitioner. I practice as a nurse practitioner as well. So I was a registered nurse, got my license, worked for a year, and then I went back to school to become a nurse practitioner, got my master's degree. We don't offer that program now, but our dean this is like hot topics, kind of keep it quiet. She's looking at maybe starting a program like that. I don't know when that would happen, but a lot of our graduates from our BSN program are asking for that. They want to come back to West Georgia because they enjoyed their undergraduate degree so much and they want that degree. So she's looking into the logistics of what that might look like. Yeah.
She kind of asked also, but you said
towards the end, before they graduate, you start preparing for the applications and things like that. Is there like a class or something?
Yeah.
Like to prepare for the test?
Yep, they actually take a class called, I think it's Preparation for Professional Licensure. I think that's the name of it, yes. It's a 1-credit course, and that whole course is designed to prepare them to take that test and prepare to apply for licensure and walk them through the steps of what to do so that they know what to do once they graduate. Yep.
Okay, so they have to go through RN classes, right?
Yes.
Because I know a certain amount of nurses go at a certain time. So how many go or eligible to go or to that RN course here, or is it not a number? Because I know like in Tuskegee, they have like a limited number of kids can go at a certain time.
I think you're asking how many are admitted each year to the
How many are
program?
admitted? Yes. So,
I was gonna say, we admitted 150 this year to our
Okay.
program.
And
We
if they're
have-
not accepted, do they have to go somewhere else, or?
We work with them, that's part of the advisor's job, and we work with them and coach them on having a plan B, whether their plan B is to apply to multiple locations,